Welcome to Your4State.com's Medical Corner. I'm Lynn Lawson. Right now we're joined by Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute, and he's our specialist on foot and ankle conditions. Nice to have you here, Dr. Michaels.
Thank you, Lynn, for having me.
Our first question for you, what are corns or calluses?
Well, corns and calluses are somewhat interchangeable, but typically a corn would occur in between, like, for example, the foot model here, the fourth and the fifth toe. And a callus would occur on the bottom or on the big toe on the side. They are very painful, and they're a buildup of skin. The skin gets thicker in this area, and sometimes it causes pain. A corn or a callus is a skin manifestation of a bony problem. So anytime you have a callus, you have a bone underneath putting too much pressure in that area.
And how do you treat corns or calluses?
Corns or calluses can be treated with many things. There's conservative and there's surgical treatment for pretty much anything that we do. So there are the corn pads. There's some that are medicated and some that aren't. If you have diabetes, you never want to use the kinds that are medicated. If you don't have diabetes, you may be able to get away with those. But if you do have a callus or a corn that bothers you, please come see a foot specialist. We can treat these things, and we know exactly how to take care of the problem in a very quick manner. Oftentimes using a pumice stone on, like, the big toe, if you have one there, using a pumice stone in the shower with the shower running with soap on it, that can file that down. If you have one in between your fourth and your fifth toe, that can be kind of hard to treat, and it's usually caused by these little bones in your toe pinching the skin from the fourth and the fifth toe. The skin gets pinched in between those bones and causes a corn. That can be very painful. Toe spacer can be used for that. If that doesn't work, wider shoes can be used. And if that doesn't work, sometimes surgery has to be done where we take out a little piece of bone to decrease the pressure that bone is producing on the skin, and the corn or the callus just goes away after that. But that's usually the last resort, and oftentimes we can treat these things with conservative care in the office.
Thanks so much, Dr. Michaels. Again, that was Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute. And don't forget, you can find more information on foot and ankle conditions only here on Your4State.com.